Greetings and welcome back to the Medical Weight Loss Show, where we discuss all things weight loss. I'm your host, Dr. Andrea Walker, family nurse practitioner and owner of Dr. Andrea's Medical and Weight Loss Clinic, as well as Telehealth DNP LLC. Today, we will discuss some of the top side effects that cause people to discontinue taking GLP-1 medications. But you don't have to stop. We'll go over practical solutions to help you manage these side effects and stay on track with your weight loss journey. These medications can be life changing, but some people struggle with nausea, fatigue, or digestive issues. If that sounds familiar, don't worry. I have strategies that can help. So grab a cup of green tea, sit back, and get comfortable. Now, let's get started. Let's dive deeper into these specific gastrointestinal side effects that many people experience while taking GLP-1 medications, such as sulfur burps, nausea, and constipation. And we'll discuss what can be done about them. These issues can lead to people discontinuing their medications, but there are ways to manage them effectively. So we'll start with sulfur burps. Why do these happen? Sulfur burps are often caused by the slower gastric emptying and delayed digestion that GLP-1 medications can induce. When food moves more slowly through the stomach, it may ferment in the digestive tract, leading to the production of hydrogen sulfide gas, which results in the unpleasant sulfur smell. So, what can be done? First, you want to gradually increase your dose. There is a reason why you need to stay on each dose for at least 4 weeks. And there's nothing wrong with staying on that same dose for greater than 4 weeks. As with other GI side effects, starting at a low dose and slowly increasing the dosage can help the digestive system adapt and reduce the occurrence of sulfur burps. And then next, dietary changes. Reducing foods that are harder to digest, like high fiber vegetables, beans, or cruciferous veggies, may help reduce fermentation in the stomach. Additionally, avoiding foods that increase gas production, like onions, garlic, and dairy, may help mitigate sulfur burps. Then you can consider digestive enzymes. Some people find that taking digestive enzymes before meals can help with digestion and prevent the buildup of gas that leads to sulfur burps. And next, antacids. Occasionally, an over the counter antacid like simethicone might help reduce bloating and gas. However, this should only be done after speaking with a healthcare provider. Now, let's move on to nausea. So, why does this happen? Nausea is a common side effect of GLP-1 medications, particularly when starting the medication or increasing the dose. The slowing of gastric emptying combined with the changes in gut hormone activity can lead to feelings of nausea, especially after meals. So, what can be done? As previously stated, you want to start with a low dose. A gradual increase in the dosage can help the body adjust and decrease nausea. Many people find that starting at a low dose for the first few weeks and slowly titrating up helps manage this side effect. So, again, keep in mind, just because it's been 4 weeks and you have the option to go up, if everything's going great and you're still losing weight, then I suggest you highly remain on that particular dose so that your chances of experiencing nausea or other unwanted side effects will be lower. And then next, make sure you eat smaller but more frequent meals. Of course, eat when you're hungry, but make sure those meals are smaller. Large meals can exacerbate nausea. Smaller meals can reduce the strain on the stomach and minimize discomfort. And then ginger. Studies show that ginger is effective in reducing nausea and can be consumed in various forms, such as ginger tea, ginger candies, or supplements. And then hydration, something I always discuss. Staying hydrated is essential. Sometimes nausea is exacerbated by dehydration, so sipping water throughout the day rather than drinking large amounts all at once may help. And then anti-emetic medications. Fancy word for medications that treat nausea. If nausea is persistent and bothersome, a healthcare provider may prescribe anti nausea medication like Zofran or prescribe over the counter remedies like meclizine. However, these should always be used under medical guidance. The last thing we will talk about as it relates to GI side effects is constipation, which is a huge one. So, why does it happen? Constipation is another side effect often seen with GLP-1 medications, really due to the slowed gastrointestinal motility. When the digestive system slows down, stool can become harder and more difficult to pass, leading to constipation. I always explain these medications and tell people that basically what they do is they're going to make you feel fuller for longer. And the food just kind of sits there in your stomach for a little bit longer than it normally would, which of course can lead to constipation, making the stools hard and harder to pass. But what can be done? You want to increase your fiber intake. A higher fiber intake can help promote regular bowel movements and soften stool, including fiber rich foods like fruits, vegetables, whole grains, and legumes in your diet is a good first step. I always tell my patients to also increase their healthy fats, things like avocado, salmon, and nuts, but don't go overboard. And then you want to stay hydrated. Drinking plenty of water is key to preventing constipation. Hydration helps keep stools softer and easier to pass. And then there's exercise. Regular physical activity can help stimulate bowel movements and improve gut motility, reducing the chances of constipation. And then, when needed, over the counter laxatives. If dietary changes aren't enough, mild over the counter laxatives like Miralax or Colace can be helpful. However, these should be used under a doctor's supervision to avoid dependency or overuse. And then there's probiotics. Whether it is incorporating probiotic rich foods like yogurt or fermented foods, or utilizing oral supplements, either or might help maintain healthy gut flora and ease constipation. So, to wrap up, let's go over a summary of digestive issues. For sulfur burps, nausea, and constipation caused by GLP-1 medications, which are Wegovy, Zepbound, semaglutide, tirzepatide, Ozempic, or Manjaro. You want to have gradual dose titration, dietary adjustments, and hydration. These are all key strategies for managing symptoms. Over the counter remedies like digestive enzymes, ginger for nausea, and mild laxatives for constipation can also help. It's important for patients to work closely with their healthcare provider to adjust the medication plan or address symptoms effectively without discontinuing treatment prematurely. Now, let's move on to fatigue. Fatigue is one of the most common reasons people struggle with GLP-1 medications, and it can be discouraging when you're trying to lose weight but feel constantly drained. So, let's talk about why this happens and what you can do about it. So, why do GLP-1 medications cause fatigue? One, keep in mind you're now, for the most part, probably eating a reduced calorie diet. So, you have reduced caloric intake. The medication suppresses appetite, meaning you're likely eating much less than before. If your body isn't getting enough fuel, you'll feel weak and tired. So make sure you eat and make healthy choices. And then there's blood sugar fluctuation. Your body is adjusting to lower glucose levels, which can lead to fatigue, especially in the first few weeks. And then dehydration and electrolyte imbalance. GLP-1s can lead to mild dehydration or shifts in electrolytes, both of which contribute to low energy levels. So sometimes people will ask me, should they be adding in electrolytes? And it just depends. If your diet is not where it should be, you're not making healthy choices, and you know that you're not eating enough, then it would not be a bad idea to add in electrolytes. There are plenty options out there. Personally, I like Gatorade that has the extra electrolytes, but I choose the one where calories are not very high. And even when I am prepping for a bodybuilding show and I know that I'm probably a little dehydrated, I will actually drink Pedialyte with extra electrolytes. And believe it or not, it tastes really good. I know we think of Pedialyte for babies, but it's really a good choice as well. Now, let's move on and discuss hormonal adjustments. As your insulin and gut hormones adapt, you may feel sluggish until your body fully adjusts. So keep that in mind. And then loss of lean muscle mass. Rapid weight loss can sometimes lead to muscle loss if you're not getting enough protein or engaging in resistance training. Less muscle equals less energy. So, this is for the people out there that are just dying to lose, 15, 20 pounds in a month. Don't do it. You will regret it. And even though you're losing weight, your body won't look that great overall in the end. So just don't do it. Now, let's discuss how to combat fatigue and stay on track. So, you want to prioritize proper nutrition. Even if your appetite is low, focus on high quality protein, healthy fats, and fiber rich carbs to maintain steady energy. This is something I say to my patients anytime somebody is having fatigue or they're not losing weight the way they want to. I always discuss prioritizing proper nutrition. So, super, super, super important. Another thing I will tell them is to stay hydrated and replenish those electrolytes if needed. And this is if you're fatigued, then yes, you probably do need those electrolytes. You want to drink plenty of water and consider adding electrolytes, sodium, potassium, magnesium to help with energy levels. I highly recommend you find a solution that already has those electrolytes added in, like I discussed earlier, something like Pedialyte or Gatorade. And of course, there are other options out there. Those are just my go to. And then you want to incorporate gentle movement. Light activities like walking, yoga, or stretching can improve circulation and boost energy without overexerting yourself. Because if you're fatigued and you're trying to lift heavy or you're trying to do strenuous workouts, then that's a no go. You're probably going to pass out or you're just going to feel terrible. But that's not to say I don't want you to work out. I do want you walking, incorporating yoga, and even stretching. And then improve your sleep quality. You need to establish a consistent bedtime routine, reduce screen time before bed, and ensure your sleep environment is restful. So many people tell me they get 4 to 5 hours of sleep. That is not enough. I actually have an alarm on my phone and it tells me to go to bed at a certain time every night. Maybe that's something you should consider if getting in bed on time is a problem for you. I recommend you get at least 7 hours of sleep. If you can do more, that's great, but 7 is the minimum. And then you want to monitor vitamin and mineral levels. Low iron or B12 levels can contribute to fatigue, so consider checking with your provider about supplementation. I offer Vitachrome as well as BioBoost injections. They're basically considered lipo injections, but they all have some B12 in them as well as other B vitamins and aminos. So they're really, really great. I'd say probably 70% of my patients add that on to the GLP-1 injections. So definitely something to consider if you're having fatigue. And then you want to slow down dose increases. If fatigue is severe, your healthcare provider may recommend adjusting your GLP-1 dosage more gradually to help your body adjust. Again, just because you have the option to go up every 4 weeks does not mean you necessarily need to. And also, you want to manage stress. High stress can worsen fatigue, so try deep breathing, meditation, or relaxation techniques to help balance energy. And then lastly, make sure you talk to your healthcare provider to see if any of these options are right for you. So, this is very important. When to seek medical advice. If your fatigue is severe, persistent, or impacting your daily life to the point you need to call in for work or you can't do your regular activities, you definitely need to reach out to your provider. It could be a sign of low blood sugar, a nutrient deficiency, or another issue that needs attention. By addressing these factors, many people find their energy improves over time, allowing them to stay consistent with GLP-1 therapy and continue their weight loss journey successfully. Wraps up today's episode on the top side effects that lead people to stop taking GLP-1 medications. I hope you found these tips helpful. Keep in mind, this podcast is for educational purposes only. Please consult your own healthcare provider before making any changes to your medication, diet, or lifestyle. If you enjoyed this episode, be sure to like and share so more people can benefit from this information. You can also follow me on Instagram at either of my business pages for more weight loss tips and updates. And if you live in Florida, Arizona, or Tennessee and are interested in a free consultation on GLP-1 medications, you can reach my office at 901-552-3518. Until next week, make sure to meal prep, work out, and drink your water. I'm Dr. Andrea Walker. Bye for now.